usual, first I'd like to ask for your permission to use these follow-up video testimonials for educational purpose.
Of course.
How long before the surgery did you have pain?
14 years.
14 years. 10 years.
12 or something like that.
How bad was the pain few years before the surgery, like the last year before the surgery?
Oh, it was intense.
Intense. 1 to 10.
I would keep going to different people, and they would just keep putting me on more drugs and telling me there's nothing I could do about it.
Yeah, and but then so practically you had high grade pain, 7, 8, 9, 10.
Yeah, all the time. My base was probably 6 or 7 on a good day.
On a good day. Okay.
Yeah.
Now, and why didn't people, or why other professions now, like surgeon and so on, why couldn't they help you? What did they tell you?
They just kept feeding me more drugs. That was the answer, more drugs. And I kept telling them I don't want to do any more drugs. And
for 10 years.
Yeah.
And we are 10 months out of that surgery.
Right.
We did a L4-5 OLLIF. That surgery was barely 40 minutes. And we have follow-up.
Right.
This is a follow-up testimonial. We have other testimonials. When did the leg pain go away?
I think it was right away. I'm having a hard time remembering exactly.
Yeah, it's a good thing not remembering it, because it wasn't as dramatic as as traumatic and dramatic as it can be. So, but pretty much right away did the pain go away?
Yeah, I'd say the surgery was in February, and by the middle of May when I was here last time, I don't think I was taking any more narcotics.
Yeah,
I'm pretty sure.
No, the back pain will take a few months to go away.
Oh, for sure. There was still, I was still taking Tylenol and those kinds of things. But now I maybe take Tylenol once a week if I've been real active.
So how is the pain you had for 10 years? Is that gone completely?
Oh yeah, I can't even remember how.
You can't even remember,
No.
And that's a good thing. In that sense, I hope you take it the right way. I hope I never see you again.
Yeah, I know.
Because that means you don't need me.
Right.
So you were a narcotic for many years. We did that literally 40-minute procedure. And how long did you stay in the hospital? Just one night?
I was there one night, I think.
One night, and then you went home. The leg pain, most of my patients are telling me, was gone right away. I have a record of it. I can look up.
Yeah.
But then usually back pain takes a few weeks, a month. How long after the surgery were you back to your basic previous life?
Fairly quickly. 2 months maybe.
Yeah.
At the most.
Yeah. Whereas after open surgery, that can take significantly longer. Right. Significantly longer.
I mean, I was active. I was probably more active within 6 weeks of surgery.
Yeah.
For
That's
sure.
what most of my patients are telling me.
Yeah.
Now, if you would look back in your life and see that 10 years and that one day hospital stay, one surgery,
right?
What would you say to yourself if you would go back, and to your providers, to the doctor who took care of you? What would you tell them? What would you want them to know?
I would have done this. I would have done this right away. This procedure, I didn't know about this procedure, but I was very resistant. They did bring up the old way of doing it with all of the, and I didn't want to do that.
And you said you had a friend that got the old way, right?
He did, yeah, and it completely ruined his life. I mean, he wasn't very good prior to, but he's now completely disabled and walks with a cane. And
Again, this is what we did. We did a wonderful OLLIF. The fusion is way advanced in all areas. You see, that's a bone crossing. That's a bone crossing here. Everything is in a good position. And look at those muscles. They're all alive. They're healthy muscles. Yeah. There is no reason to believe on our side that the surgery itself will deteriorate you more. Because in a regular surgery, we literally fillet you open. We cut all those muscles away here.
Really?
And all those muscles die. And if we cut the muscle here, some of those muscles go to the levels above even. And we are destabilizing. There's no reason to believe in your case that will be the case, but we are gathering our data for our study.
Yeah. No, I'm very strong. I feel awesome.
Excellent. That's a good Christmas gift for me to know that we can do that for our patient. Well, thank you so much for this interview.
Of course.
I really appreciate it.